Today we will be discussing the principles of health education. Before moving to the principles, I'd like to tell why we need an health education. Health education plays a very important role in our life to know about the disease, to know about being a healthy. Moving on to our definition given by WHO Health Promotional Glossary, it states that health education comprises of consciously constructed opportunities for the learning involving some form of communications designed to improve the knowledge, health literacy, developing life skills which are conducive to the individual's and community health. Now moving on to our principles, first is credibility. It is in simple words, credibility means trustworthy. Now, if there is some people who need to get to know about the disease, being a doctor, first I have to tell them that I am a doctor, I am specialist in this field. Then only the people will trust me and will listen to me whatever I am saying. The first is credibility. It is the degree to which the message was communicated and perceived as a trustworthy by a receiver. So the trust should be there in among the people to whom we are giving a health education. Next is interest. Before the giving the health education, the topic of interest should be there. We should do the need of people, what they basically need. Now, if there is problem of dental caries in some area and we are giving them uh, health education on a different topic, then it won't be that much interesting. If the people are having dental caries and if they get to know how to cure the dental caries, how to reduce the dental caries among that geographical area, more participation among them. It is based on the psychological principle and active learning. The more the interesting topic, the more will be the participation by the active participation by the people. Now the motivation. The fourth principle is motivation. In every person there is fundamental desire of learning, and awakening of this is called as motivation. The motivation plays a again very important role in stoppage of habit. In fact, in everything. Primary motives are food, clothing, and shelters, whereas secondary motives are desire that creates due to other forces like praise, love, gifts, etc. And motivation is contagious. Now next is comprehension. The in health education know the level of understanding. Exactly, the people should know the level of understanding. Now, if you're giving a health education on dental caries and you tell the people that having a karyogenic diet will cause the dental caries. Now, this karyogenic word again won't be understood by the people. So, instead of this, you can say having a food which is sticky in nature should avoid to prevent a dental caries. This is the comprehension, that is the level of understanding. Next is reinforcement. It is the booster dose of health education. Now reinforces, like, we need to make people learn more and more. If you give a definition of if you explain how to give a brushing technique, if you explain them that this is the proper brushing technique, make it them to do again and again, so that it will be helpful for them to learn easily. Next is learning by doing. Again, it is a famous Chinese probe given. I hear, I forget, if I see, I remember, if I do, I know. It's illustrate the importance of learning by doing. If you are giving again a toothbrushing example, be specific that the people should adapt it and they should know how to do this. Known to unknown, in health education, work proceeds from the concrete to the abstract, simple to the it is moved from simple to the complicated, easy and to more complicated, and known to unknown. Setting an example, a good example, if you said there will be more easy learning for the people, the health educator should set a good example things in his teaching. Good human relationship, building good human relationship with the people goes hand in hand in developing the communication skills. There should be a proper feedback taken from the people after the health education through various messages or through various channels. You can have the feedback. Then there are leaders. Leaders are the agents of change in health education. Now, if you approach, suppose there is a leader of community, if you approach him in the community, it will be easy for the people to communicate. When the leader will communicate with the people of the society or the geographical area, they will believe in, and there will be good participation in the health education. After health education, we will be discussing about the school dental health and school dental health programs. This was started by William Fisher in England. He said that he noticed that there is a tremendous amount of dental caries among the children. So he proposed this, that there should be compulsory attention of to the teeth in the school-going children. In India, it was started in Baroda city in 99, where the first dental or medical examination of the children were done in India. Burkamut also reported that there is lack of health education program in India in developed and undeveloped states. In 1982, government developed a task force to accomplish the school dental health projects. There are the few what should be the procedures, and it should be the health status of the children should be known. The counseling of the people should be done to encourage, to assist, to help them, and to prevent and to provide an emergency care. These are the procedures which are established in the school health services. The aspects of the school health services is health appraisal. Now, the health appraisal is a process by which we get to know about the health status of a children through parents, through teachers, through the community workers. After appraisal, there is health counseling. Counseling will always follow the appraisal. Counseling is the method or the procedure by which the children is educated about being healthy. They are instructed how to maintain their dental health and general health. Emergency care and first aid. So though the teachers are the first person who are in contact with the students, though it's our duty to teach the first aid application to the teaching. There should be some teaching program or to treat the first aid emergency first aid provision to the children. Then there is school health education should be given for the maintenance of proper hygiene. In every school it should be instructed maintenance of healthy hygiene, personal hygiene, toothbrushing techniques, all should be instructed. Methods to prevent dental caries. There should be school water fluoridation. Everything this has should be taught in the school health education. Maintenance of health records will help us to know about the current status or the previous status of the children regarding the health. And curative services like easy treatment and curative treatment should be provided to the school children. These are the ideal requirements of the health program. It should be administratively sound, that it should not be a very much difficult procedure. It should be accepted by the children. It should be available for every children. Aid in the development of favorable attitudes towards the dental, provide environment so that the children will be easy learning. The school is the first place where the children is very much comfortable rather than a dental office or dental clinic. So it's better to be given more education regarding the dental health to children in the school. It includes primary preventive procedures like prophylaxis should be given, fluoride, pit and fissure sealants can be given in the school, provide screening methods for early identification and referral of pathology. Advantages, now coming to the children are available for the preventive treatment procedures. As you can see, when the treatments are done, it will be easy for children to maintain their dental health. School dental health program facilitates central education and dental to subjects. The dental services supplements the nursing services by helping to provide a total health care for the school children. Now these are the three elements: improving school community relationships, conducting regular dental inspections so that the procedures which the doctors or technicians or school dental nurse is providing, whether they are right or not, whether the proper funding, proper procedures has been followed or not, and conducting a health education regularly should be the primary motive of the school. Performing specific programs like toothbrushing programs, you can instruct them toothbrushing techniques, school water fluoridation programs, sealant placements, science fairs. Referral to dental care and follow up the dental inspection. School dental, these are the various school dental health programs has been carried out. Learning about the oral health and prevention carried out in USA, as about dental health education program, school dental nurse program, tattle tooth program. This tattle tooth program can be asked as a short note. Teenage health theta program, North Carolina statewide preventive dental health program. Sharp, that is school health educational referral program, Colgate Bright Smile, Bright Future program, and WHO's Global Health Initiative program. Now coming to our Tattle Tooth program, it was developed in year 1974 and in 1985 extended to 3 million children. Here the three types of videos were prepared, and the teachers are the first one which will be in contact with the children. So the teachers were giving the training procedures. In the first video they were instructed how to teach the children. Second procedure, in the second video they were instructed about the brushing techniques, all the dental procedures which they can have in the school. And third was the learning capacities of the children, recording how the children will learn, how they will adapt to the school dental services. The program philosophy and goals were deals mainly with the health education in the field of primary prevention. Teacher training packages were done. Basic goal of the program was to reduce dental diseases and develop dental habits, good dental habits, that will last for the lifetime. Now next is incremental dental care. It was started by Cunningham in England. Proposed the system in 1907. The care should be given in every increment of their life. That the first increment should be given at 6 months of the life. Then they should follow up. By the system, all the ages of the priority should group will reach within 7 years, and probably more efficient than by haphazard treatment of whole 6 to 12 years old group initially. There are some school-based preventive programs has been done: oral health education, dentition and related structures, sugar and dental health education, fluoride therapy should be given. There should be regular dental visits. Classroom toothbrushing technique should be instructed to the children. Fluoride therapy, fluoride tablets, fluoride lozenges, or fluoride mouth rinse program should be conducted. School-based sealant program should be done. In Asian Declaration of Oral Health Promotion, there are two uh, taken. That is, in first Asian Declaration, oral health promotion for school children was carried out in year 2001, known as Tokyo Declaration. The second Asian Conference of Oral Health Promotion of School Children, Ayutthaya in Thailand, in 2003, it has been carried out. The theme was Prospectus of the Future Generation. This is the campaign WHO workshop, Prevention and Promotion of Oral Health Through School. In Bangalore Declaration, it has been done. Oral health activity in India, there were Bright Smile, Bright Future, Colgate Palmolive initiative to create awareness among the schools. Oral Health Month, again 9th October has been suggested. Mission Zero to Decay with the spread of smile. Over 1.5 lakh school children all over the India brushed together in an attempt to increase oral hygiene. With this end, we would like to conclude my lecture. Thank you.